Hello everyone, I am Andrea Mores Gabica and I'm going to discuss about Thromboangiitis Obliterans. Thromboangiitis Obliterans or TAO, also known as Buerger's disease, was described in 1908 when Buerger published his classic paper and later his book in 1924. It is a non-atherosclerotic inflammatory disorder of unknown etiology that affects a small and medium-sized vessel of the extremities and has a strong association with smoking. So, natin susugad nga Thromboangiitis Obliterans. Thromboangiitis Obliterans, it is a inflammation and subsequent blockage of a small and medium-sized arteries of the legs or arms. So, here's what Buerger's disease looks like. So, ada na pili sa fingers, it is the dead tissue, the obstruction, and the other side naman, na may mga ugat-ugat is the obstructed blood vessel. For the prevalence or incidence, so ang disease, nag-occur siya more often in men than women and commonly found sa mga lugar sa Middle East and Far East, India, and Southeast Asia. There is increasing incidence of the disease in women older than age 50 years. Moderate to heavy cigarette smoking is directly linked to the progression of the disease. It may be classified as an allergic response in some people in whom the body reacts to properties in nicotine. So here's the pathophysiology of Buerger's disease. For the non-modifiable risk factors, we have male, 20 to 40 years old, and hormonal influence. For the modifiable risk factors naman is lifestyle, cigarette smoking, and heavy tobacco use. Ang etiology is unknown, and as we know, smoking is the risk factor of Buerger's disease. Hindi siya pinaka-risk factor good. Kaya ang smoking, nagko-contain niyo siya sa carbon monoxide and nicotine, which causes vasospasm and intimal hyperplasia of vessels. Ini siyang carbon monoxide and nicotine. These are the dangerous duo kay it also increases the amount of cholesterol that is deposited into the inner lining of the arteries, which over time pwede mag-cause sa arteries to harden. So, ito nga, nagkakause sa vasospasm and intimal hyperplasia of vessels, which leads to thrombosis. In turn, it also causes panenteritis. Then, pag nagkaroon ng panenteritis, eventually, nag-involve an artery, vein, and nerves. Due to involvement of all these structures, an artery, vein, and nerves, following manifestation can be seen. So, for the artery, we have intermittent claudication. So, an intermittent claudication, it is the pain affecting the calf and less commonly the thigh and the buttocks that is induced by exercise and relieved by rest. So, ang calf, yun siya ang posterior portion of the lower leg. Ngan, sa vein naman, we have thrombophlebitis or the superficial thrombophlebitis. Hindi siya severe type. Ngan, and sa nerves naman is pain in rest. Kapag diri ni siya naagapan, it can lead to tissue necrosis. So, as the Buerger's disease progresses, numbness, pallor, coldness, and pain occurs due to tissue death. Ngan, tissue ulceration can be formed and pwede siya mag-lead to gangrene. So, ang gangrene, mga na imod ta kanina nga picture nga ang fingers or toes is nagpipili. Ito siya ang dead tissue or ang gangrene. It is a greenish black color sa skin. Nga pwede siya mag-lead to amputation. So, uturon an finger or an toes if may nakita sa dead tissue. Next is the clinical manifestation. Number 1, we have numbness and tingling of the toes and fingers in cold weather. Then pain in the hands and feet that most often occurs when at rest. So, and pain may be worse when the hands and feet get cold or during emotional stress. Then, intermittent claudication, itong mention ko kanina, that progressively becomes more severe and the pain is intense. So, it may feel like burning or tingling sensation, tapos an ulceration and gangrene severe or late signs of the Buerger's disease. For the laboratory and diagnostic examination, number 1 is ultrasonography. It detects a substantial decrease in blood pressure and blood flow in the affected feet, toes, hands, and fingers. And then we have angiography. It can detect special or specific patterns of narrowing and thus can help confirm the diagnosis. Next is the physical examination, and in rare cases when the diagnosis is unclear, a biopsy of the blood vessel is done. Next is medical and surgical management. So we have sympathectomy. It is a type of minimally invasive procedure which involves cauterizing a portion of the sympathetic nerve chain that runs down the back inside the chest, parallel to the spine. For the medications, we have vasodilators that are rarely described cause the dilation of the healthy vessels. Then, medications that dilate blood vessels such as iloprost. It may help heal ulcers and reduce pain in people who quit smoking but still have blocked arteries. Other medications such as pentosyphylline and calcium channel blockers may be tried to help open blood vessels, pero probably dili gud siya effective. Then we have the bypass surgery and the amputation. Next is nursing management. So, patient teaching, we have to instruct the patient to do the following several times a day. So, we have to instruct to lie flat on a bed with both legs elevated above the level of the heart for 2 to 3 minutes. Then next, sit on the edge of the bed with the legs dependent for 3 minutes. Exercise the feet and toes by moving them up, down, inward, and outward. Lastly, return to the first position and hold for 5 minutes. Then we provide for ulcer debridement and healing. Remove dead or damaged material from the wound using wet to dry dressing with saline solution and coarse mesh gauze filled with cotton. Use whirlpool therapy to debride the ulcer bed, then consider using an enzymatic debrider to aid removal of debris. Then we provide additional interventions to promote venous rectum and healing, maximize comfort, and improve client education for measures to prevent venous stasis ulcer. Then we encourage patients to make lifestyle changes necessitated by the onset of a chronic disease, including pain management and modifications in diet, activity, and hygiene, for example, like skincare. Then lastly is assist the patient in developing and implementing a plan to stop using tobacco. For the prognosis, so rare naman la kasi ang case ng thromboangiitis. So if symptoms of thromboangiitis may go away if the person stop using tobacco. People who continue to use tobacco may need repeated amputations. That's all for my report. Thank you for listening.